Morning, everyone. I am discussing the transfusion transmitted disease. First, what is blood transfusion? Blood transfusion is a life saving intervention that has an essential role in patient management within healthcare system. The establishment of system to ensure that all donated blood is screened for transfusion transmitted infection is a core component of every national blood program. For the introduction of this, the blood transfusion is the process of receiving blood or blood products into circulation intravenously. These are the infection microbes transmitted by blood transfusion. First, HIV. Second is HTLV. Third is the hepatitis B and C. Next is Epstein-Barr virus. The next one is bacterial contamination of blood products. Next is syphilis, and the last is malaria. For human immunodeficiency virus or HIV, the classification are for the family Retroviridae, genus Lentivirus, and for the species or types HIV-1 and HIV-2. Lentiviruses are single-stranded, envelope icosahedral RNA viruses. For the HIV replication cycle, first is the entry and uncoating. The next one is formation of dsDNA by reverse transcriptase enzyme and integration by integrase enzyme. The next one is stay latent or reproduce by producing the RNA and proteins. The next is assembly, and the last one is release by budding destroying the cell. The routes of HIV transmissions are unprotected sexual transmission, blood transfusion. From mother to child in late pregnancy or during birth, breastfeeding. Needle sharing injection drug use. The next one is percutaneous needle stick. The last is tissue transplantation. For the human T-cell lymphotropic viruses or HTLV type 1 and type 2 virology, for the family, it is Retroviridae, and the genus is Delta-Trovirus oncovirus. For the pathogenesis, the virus infects the cell and activates some host cell genes and places the infected cell in uncontrolled mode of the growth. The majority of infected patients stay as carriers. Some patients develop adult T-cell leukemia or ATL after 20 to 30 years. The mode of transmission of this is sexual route, blood transfusion, vertical transmission, breastfeeding. The laboratory diagnosis is PCR for detection of provirus genome, anti-HTLV antibodies by ELISA. Hepatitis B virus. Family Hepatnaviridae, icosahedral envelope dsDNA virus. It is the one of the smallest envelope animal viruses. Pleomorphic forms exist in the patient's serum, including spherical and filamentous bodies lacking a core, non-infectious lipids, and protein surface antigen. The mode of transmission are highly infectious, sexual route, vertical route. Transmission of virus from mother to child during childbirth, prenatal. Transmission of viral genetic material within the cell. Parenteral route, blood transfusion and contaminated syringes. The diagnosis is detection of hepatitis B virus surface antigen and anti-HBC by ELISA. For the hepatitis C virus, the virology is enveloped single-stranded RNA virus. Family Flaviviridae. Genus Hepacipvirus. The mode of transmission is blood products transfusion in injection drug use, sexual exposure. The diagnosis is PCR ELISA anti-HCV hepatitis C transmission in developed countries. The next one is Epstein-Barr virus or EBV. The virology family is Herpes viridae. Envelope icosahedral dsDNA. It derives envelope from the nuclear membrane of the host cell. Established latency B lymphocyte. The transmission direct is person-to-person contact. For the example of this is saliva. Most adults are seropositive blood transfusion. The pathogenesis of EBV infects nasopharyngeal epithelial cell, salivary, and lymphoid tissue. EBV diseases and malignancies diseases asymptomatic in infants and young children. For the bacterial contamination of blood products, it is the most common and severe infection complication associated with blood transfusion. It has been estimated in 1 in 40,000 units of blood and 1 in 3,300 units of platelets are contaminated with bacteria. Normal flora of the skin, such as Staphylococcus epidermidis or Staphylococcus aureus, which is the gram-positive cocci, are the most common bacterial contaminants of blood products. Gram-negatives, such as E. coli, may contaminate the donation when blood is collected from donors who have bacterial infection with symptoms. Treponema pallidum, bacteriology, or the Treponema pallidum is known as syphilis. Thin spirochete, basically it has a gram-negative cell wall. Axial filaments present. Endoflagella cannot be cultivated in vitro. Serodiagnosis obligate pathogen but not intracellular. The mode of transmission of this is sexually, transplacentally, and by blood transfusion. The pathogenesis are: for the primary, genital sancre of skin; secondary, skin lesion latent infection; tertiary, CNS and cardiovascular infection. The diagnosis of this is direct. For the direct, detection of the bacteria by dark field or immunofluorescent microscope. For indirect, serology, non-treponemal antibodies, non-specific antibodies. Anticardiolipin with VDRL or RPR test. Treponemal antibodies is specific by TPHA or IFA. For the malaria, the microbiology classifications are Sporozoa, Plasmodium species. Example of this is P. vivax, P. malariae, and P. ovale, and P. falciparum. The transmission is bite of female Anopheles mosquito, transplacental, and by transfusion. Man is intermediate host, and the Anopheles is infinitive host. The pathogenesis of this is infection of liver, like jaundice, hepatomegaly, infection of red blood cell, infection of hemolytic anemia, and splenomegaly. Thank you for listening.